My stomach was just filling up with blood and I just knew I was going to die. Let me explain. Hi, my name is Savannah McKee and I'm hoping that other women can relate to my story. In 2020, I found out that I was pregnant, and then a couple weeks later, I found out that it was an ectopic pregnancy. I kept going to the doctors and they were checking for the baby. They were checking the ultrasound. They did the top ultrasound. They went inside ultrasound and they couldn't find the baby, so they didn't know exactly what happened because what are they, HCG, one of those levels, when they take blood and they check to see if you are pregnant, were very high, and then they started dropping. So once they start dropping, they know, okay, something's happening, you're having a miscarriage. Once they found out that the baby was in the tube, the doctor was like, you're a candidate for some type of medicine, something with the M. Very long word. You know how it is at the doctors. So I was like, okay, that didn't sit right with me. So I called my husband. I'm like, can you tell my husband what it is? Because my husband's very smart. And he was like, okay. So I called my husband and I asked him, is it okay if I get this shot? They said they want to put the shot. The shot has to go in I think it was my hip, a little bit lower, maybe my hip. And it was this long needle. And he said that I have to give you this medicine so that, the baby obviously do I say the baby was dead? I don't really know. Like, it stopped forming, right? So it was in the tube, stopped forming. But in order for it to, I guess, disappear into like thin air or whatever, I have to give you this shot. When I give you this shot, for a week, you cannot eat any green foods. And I'm like, green foods? Like, basically, you need to eat hamburgers, fries, like every day. Because if you eat anything with folic acid, look, I think I'm saying all these names wrong, but I feel like you understand. The folic acid, I believe, or something, if you have any foods with that in there, which is everything green, which is all good foods, it's going to continue to grow the baby. So I had to follow up the next week and I had to go see the doctor. So when I see the doctor, I sit down. He's like, okay, how's everything going? I'm like, oh, good, eating these burgers. And then he said, are you feeling any pain? I told him I wasn't feeling any pain. He said, if you feel any pain, you need to go to the emergency room, because if that tube erupts, you can possibly die. Now I'm like, die? Well, what type of pain am I supposed to be feeling? Because as women, we can tolerate a lot of pain. We have children, we have periods. So it gets pretty painful, crampy. He said, if you feel any pain that is it's unbearable and it's unusual. And I'm like, okay. I think it was about at 10 o'clock at night, I was wrestling in the bed with my husband, and we just chilling, having fun. Like, he put me in a headlock, kissing me and stuff like that. That's how he shows love. And I started having pain. My first thought was, okay, the doctor said if you have any pain, go to the hospital. But this is around COVID time. So I know I'm going to be at the ER for hours and hours, and they're not going to be able to see me. And it's just going to be a long night. So I'm like, I'd rather not go. So I'm laying there and I told him, like, all right, chill a little bit. Like, I don't feel good. He's like, you all right? I said, I don't know. Something just don't feel right. Let me lay down and go to sleep. I'm like trying to go to sleep, but I can't go to sleep because the pain is getting stronger and stronger. And I'm like, okay, I think it's time. I think I need to go to the hospital. But some said pray. So I'm praying. I'm just laying there and I'm praying. And I'm just like, the voice was so loud. It was so clear. It was like God came down and said, Savannah, get up. Get up, Savannah, because he knew if I laid there that I would go to sleep and I wouldn't wake up. But I wasn't going to know how bad the pain is, like the doctor said, unless I stood up, because when I'm laying down, it wasn't as bad. So the moment I stood up, I got up. I felt like this, like everything was heavy. I felt like something was coming out of me, but I knew there wasn't a baby. The doctor had already said there was basically no baby. The baby was stuck in the tube. So what feels like it's pouring out of me? I couldn't walk. It was so heavy, and I can feel something filling up in my stomach, and I didn't understand what was going on. I said, okay, this is it. You got to take me to the hospital. You got to take me to the hospital now. We're at the ER, And we get in there. Of course, it's freezing cold outside. They don't let you in the hospital because it's COVID going on. And when we pulled up, I'm like walking up, and I'm like holding my stomach. And when I'm holding my stomach, they're just like, and how do you spell your name? Have you been here before? Gave me a wheelchair because I couldn't walk. So I couldn't walk. I'm sitting in the wheelchair. My husband's sitting next to me, and he's sitting here on his phone playing Words with Friends. It's like, bloop, bloop, bloop. That's all I can hear. Everything else around me, I can't hear but him playing that phone. And I turned to him, and I looked at him, and I told him, I'm about to die. I can feel it. I feel like I'm about to die. Oh my God, I've never cried on camera. Okay, and so men, they don't really have any expression. He kind of just still was playing on his phone, and he just kind of like looked up at me. So a couple minutes went by, and I told him, you could just go home because I don't know how long I'm going to be here. And he was very tired. I know he was tired. Right now it's about 11 o'clock. I started about 10. It's about 11 o'clock now. And he waited a little bit. They came out, they got me, they took me to the back, and she started doing an ultrasound on me. I could not even get onto the bed because when I was getting onto the bed, I promise you, it felt like everything inside my body was coming out of me. It was pouring out of me. I had blood going all down my leg. It was so much blood. You would pass out from the blood. I'm trying to get onto the bed. The lady had to help me get onto the bed. And when she helped me get onto the bed, she pulled everything up, but she was like, I have to go from the inside to see. She's looking, and I'm watching her on her little computer, and she just clicking, and I'm looking at her face, trying to detect, like, telepathically. Is that how you say it? And from what I know, I guess the ultrasound techs are not supposed to say anything unless the doctor says so. So I'm just staring at her like, am I dying? Or like, what's going on? Then she said, you have to go to the bathroom, huh? Because I can't really see too much. Because I guess when you're pregnant and then like you got to go pee, your bladder fills up. I go to the bathroom. She checks again. And then she has this look on her face, but she's trying to keep it cool. Now I'm scared. Once I got a room, I get in there, and I just feel like something is weird, and nobody wants to say anything. So I'm just laying in this bed all alone. My husband went home. On top of that, he couldn't come in anyways because it was COVID time. So I'm laying in the bed. The doctor comes in, and when I tell you, he had this scared look on his face, like, how are you looking scared and you're the doctor? He said, what we saw on the ultrasound is a lot of liquid. There was a lot of liquid going on. And in my head, I'm like, okay, like, so I'm just looking at him like, what does that mean? He said, it's so much liquid, but the liquid is blood. It's filling up in your stomach, and it's filling up fast. And when he was talking to me, he was shaking. So the only thing that I can think of, oh my God, having to stop because I can't believe that. I'm like crying. I normally talk about people when they cry on the internet. But he said, we need to get you in the emergency, in surgery. You have to have an emergency surgery now. And I was like, okay. And he was like, okay, I'll be right back. But mind you, he's like this, shaking. And I think he's looking at me like, wow, this girl is getting ready to die today. So I grabbed my phone and I called my mom. Well, first I called my husband, and I called my husband. And when I called him, he was like, oh, I'm tired. And I couldn't, like, how do you tell somebody you're getting ready to die? Briefly, we didn't really understand. So as I'm telling him, he's like, okay, well, I'll call you. I'll call and check up on you in a little bit. Like he's getting ready to go to sleep. And it kind of sounded like he was just so sleepy, he didn't really know what was going on. So I respected him so much. I was just like, okay, like I didn't even want to stress him out. So I kind of just was like, okay, good night. So I call my mom, and I'm telling her what's happening. And then she's calling my aunt, and she's praying for me. We're praying. The doctor comes back in, and like as if he just looked in just to see, like, are you okay? Like, is she still here? She's still breathing? The only thing that's going through my head is I know my son Mason will be okay, but I'm worried about my daughter if I die. So what am I gonna do? But there was like this nurse, the guy, he kept coming in. He was like, you all right? I'm like, yeah, give me some more of that medicine. Like, because